Okay, sige, let's start na ha. So, from the introduction, sabi natin, this is NCM 312. Okay, tama ba ako? Yan. Tapos, ang isa sa mga topics na i-discuss natin is the topic of oxygenation. Di ba? Sabi, care for clients with problem in oxygenation, fluids and electrolytes, etc. So, yung umpisa natin is problem on oxygenation. So, pag sinabi nating oxygenation, ano bang ibig sabihin niya? Ang ibig sabihin yan, anything that concerns about gas exchange. Anything that concerns about giving oxygen to our tissues. Okay? So yung CU1 hanggang CU5 are all topics dealing with problems in oxygenation. Now, what are the systems of the body responsible for oxygenation? Diba? Una, syempre, we have the blood because the blood is the one carrying oxygen. Mga anak, pwede sumagot ha, pwede sumagot. Nung nagre-record ako, wala na akong kausap. Ngayon may kausap ako, sasagot tayo. Sa chat box, okay na sa akin yung sa chat box. Kapag alam mo yung sagot, sasagot ka ha. Okay, very good. This is the one carrying what? This is the one carrying oxygen. Very good. Okay. Then we have the heart. Okay. So yung heart, this is the one that will ano ba yung function ng heart, diba? First year ka pa lang sa nursing, alam mo na that you are loving a person from the bottom of your hypothalamus. That the heart has nothing to do with loving, it has something to do with pumping blood. Correct. So it is the heart that actually pumps blood to different parts of the body. So yung blood ang nagke-carry ng oxygen, yung heart ang nagpa-pump, ano yung nagdi-distribute, and malamang we have the blood vessels. So the blood vessels distribute blood. Ayan, yan ang nagdi-distribute ng blood. Okay? So paano ba nagdi-distribute ng blood yung mga blood vessels natin? The blood vessels are lined by smooth muscles, di ba? Yung mga blood vessels natin, meron silang smooth muscles. Meron silang smooth muscles. Okay? Ano yung mga blood vessels that are lined by smooth muscles? We have arteries, we have veins. Okay. So they are lined by smooth muscles. So ganito yan ha. When smooth muscles contract, blood vessels constrict. When smooth muscles relax, blood vessels dilate. Constrict, dilate, constrict, dilate, constrict, dilate. So the blood is being pushed to different parts of the body. So the arteries and veins, we call them distributing vessels. Again, the arteries and veins are called distributing vessels, and these blood vessels maintain what we call the vascular tone. Constrict, dilate, constrict, dilate, constrict, dilate. Yan. Okay. Now the arteries class will carry oxygenated blood and bring blood to different parts of the body. The arteries carry oxygenated blood except anong artery ang nagkakaroon ng unoxygenated blood? Except, very good, pulmonary artery. Very good yan, anak. And the veins will carry unoxygenated blood back to the heart, except pulmonary veins. Very good. O kailangan na-recall natin yung Anaphysio. Di ba sabi ko sa introduction, kaya yung Anaphysio, prerequisite dito sa 312 yan. So dapat na-recall natin yan. Okay, so the CU1 and the CU1 and the CU1 hanggang CU5 will deal about disorders of the blood, disorders of the blood vessels and the heart, and of course we have the lungs or the respiratory system. Ayan, the lungs. Ayan, the respiratory system. Ano naman ang function ng lungs? Siyempre, the function of the lung is for gas exchange. Okay. Yung blood ang nagkakarry ng oxygen, yung heart ang nagpa-pump, yung blood vessels ang nagdi-distribute, and the lungs are responsible for gas exchange. Okay. So ito yung mga organs that are responsible for oxygenation. If you're going to see them as a system, so meron tayong hematologic system, that's your blood. We have the cardiovascular system, that's the heart and the blood vessels. then we have the respiratory system. So disorders of the system will affect the body's oxygenation. Nakakasunod ka ba? Are you following? Mabilis ba or okay lang? Okay lang. Okay, very good. Yan. Sasagot tayo sa chat box ha. Alam mo, pagka sumasagot ka, nakikita ko yung pangalan mo. Naalala ko. Oh, pag naalala ko yung pangalan mo, pagka may gagawa ko ng grades, maalala ko yung pangalan mo, di ba? Okay. Class, tell me, pag may problema tayo sa hematologic system, we alter the oxygenation. Tama ba? That oxygenation problem in the hematologic system will result to anemia. Ang problema doon, anemia. Okay. Pag may problema naman tayo sa cardiovascular system, when there is decreasing tissue perfusion, ang problema naman na yon, ang tawag ay ischemia. Diba? Okay. Kapag sa respiratory system naman, there is problem on gas exchange, ang tawag naman doon ay hypoxemia. Are they all problems in oxygenation? Oo. Pare-parehong oxygenation problem yan, pero iba-iba naman ang definition yan. Pag sinabi nating anemia, anong ibig sabihin yan? There is decreased oxygen carrying capacity of the blood. Okay, of the blood. Pag sinabi nating ischemia, there is decreased tissue perfusion. Okay. Decrease oxygen blood flowing, ha? Siyempre, decrease pa rin ang oxygenation yun. Perfusion. Pag sinabi natin hypoxemia, ano naman ang ibig sabihin yan? There is decreased oxygen in the blood. Magkakaiba yan, anak. Magkakaiba yan. Okay? Pero, pare-pareho ba silang problem on oxygenation? Yes. Okay. Lahat itong mga to, all of this will lead to problems called anong ililid niya? This, ayan, very good. All of this will lead to hypoxia or decreased oxygen to tissues. Very good. Naku anak, mukhang nanood na kayo ng lecture ko ng Thursday, ha? Okay lang yan. No problem with that. Okay. So this can lead to hypoxia. So anong nursing diagnosis natin? Ineffective tissue perfusion. That's a nursing diagnosis. Imagine yung blood problem, yung cardiovascular problem, yung respiratory problem, iba-iba yung sakit. Pero pare-pareho yung mga signs and symptoms of altering oxygenation. So pare-pareho yung nursing diagnosis. Ano yung nursing diagnosis? Ineffective tissue perfusion. Okay. So ano yung topic ko? Ang topic ko, CU1 at saka CU2. Kasi yung CU1 at CU2, cardiovascular problem. Yung CU3 and 4, respiratory problem. Tapos yung CU5, hematologic and vascular problem. Okay. Saksakan ng haba ang mga topics na ito. Tapos dun sa CU1 at sa CU2, medyo inuna nila yung mga heart failure. Mga anak, hindi ko susundin yung pagkakasunod-sunod doon sa modules, ha? Susundin ko to sa paraan na alam ko na madi-deliver ko ito ng mas maayos at mas maiintindihan natin. Okay, so we will start off with anatomy. China, you raise your hand. Do you have any question? O napindot lang to? China, sagot ka sa chat box. May tanong ka ba?
Sorry, Doc, napindot lang po.
Napindot lang. Okay, it's okay. Okay lang, no problem. Okay, so i-discuss ko to. Mag-umpisa tayo sa anaphysio. Sa module din naman, nag-umpisa sa anaphysio. Sana nagbasa ka na, ha? Okay, pero doon sa module, merong inflammatory heart diseases, tapos heart failure. Tapos yung CU2, coronary artery disease. Tapos yung hypertension nasa vascular, nasa CU5. So parang medyo gulo na naiba siya ng pagkakaayos. Yung ginawa kasi sa modules, that's a team na yan na gumawa, no? So they feel na gano'n ang magandang pagkakaayos. Sa akin hindi, sorry naman na. Pero i-deliver ko naman yan the way I think na mas madali para sa ating lahat. Okay? So mag-uumpisa pa rin tayo sa anatomy and physiology. So cardiovascular system. Okay. Disorders of the heart ang i-discuss ko. But I would like also to discuss the anatomy of the blood vessels. Dito muna tayo sa blood vessels ha, para pag nag-discuss si Ma'am Nicolas ng peripheral vascular diseases, hindi niya nababalikan tong blood vessels ha, kasi na-discuss na natin yung anatomy and physiology. And as I said, di ba yung blood vessels natin, meron tayong arteries, meron tayong veins. Anong tawag natin dyan? Distributing vessels. So, yung distributing vessels natin ay arteries and veins. Arteries and veins. These are the distributing vessels. Okay. Paano nga sila nakaka-distribute? Kasi they have smooth muscles. Okay. Halimbawa, ito yung blood vessel ha. Magdo-drawing tayo. Okay. Now, the wall of the blood vessel class is actually, ayan yung wall. Meron itong tatlong layers. Tatlong layers yan. Okay. The innermost layer, okay, of the blood vessel, ang tawag ay tunica intima. Tunica means layer. Tunica intima. Now, the middle layer, yung middle layer class which contains the smooth muscles, ang tawag natin ay tunica media. Naalala mo na ba ang anatomy mo? Check. Okay, and then we have the tunica. This is the outermost layer. Ang tawag natin ay tunica externa. Ayan. So we have the tunica externa, the tunica media, and the tunica intima. Okay. Nasaan nga ang smooth muscles? Nasa tunica media. Ayan. We have the smooth muscles in the tunica media. Pag nag-contract itong mga muscles na to, magko-constrict ang blood vessels. Pag nag-dilate, pag nag-relax, magdadilate. Constrict, dilate, constrict, dilate, constrict, dilate. That's how it moves, diba? Anong tawag natin doon? We call it the vascular tone. Okay. Itong arteries class, okay, take note ha, itong arteries, it has the thickest tunica media. Ang kapal ng smooth muscles niyan. Therefore, okay, the arteries have higher pressure inside. So, mas mataas ang pressure ng arteries kesa sa veins. This is the reason why arteries are called resistance vessels. Kasi mas mataas yung pressure sa loob. Kaya kapag nabutas tong arteries na to, pag tinusok mo yung arteries na yan, ang characteristic bleeding mo, spurting, gumaganong-ganon. Kapag nakita mo yung bleeding, spurting like that, arterial yun. Ang taas ng pressure sa loob eh. Pag kumuha ka ng blood, gagamitin mo yung artery, tutusukin mo ng, halimbawa yung pulse mo rito, tutusukin mo ng syringe yan. You don't need to aspirate eh. Pag tusok mong ganun, yung plunger tumataas eh. Kasi mataas ang pressure sa loob. Okay? This is the reason why the arteries create pulses. They create pulses. So, tandaan mo, pag nag-a-assess ka ng pulses, anong ina-assess mo? Sumagot ka, arteries or veins? Sumagot tayo para gising tayo, gising. O yan, very good. So pag nag-a-assess ka ng pulses, nag-a-assess ka ng arteries. Very good. Siguro naman mga anak, do you know the location of your pulses? Do we know the location of the pulses? From the head to the feet. Alam natin ang location ng pulses? Yes. Oy, dapat alam mo yan ha. And the grading of the pulses is 0, diba? Plus 1, plus 2, plus 3, at saka plus 4. Diba? Ganyan yung grading natin eh. Pag 0, ano? Absent. Pag plus 1, it is weak. Okay. Pag plus 2, it is normal. Ayan. Pag plus 3, it is increased. Okay. Pag plus 4, it is bounding. And bounding pulses may be abnormal. O yun, sinabi niya, very good. Temporal, carotid, apical, radial. Marami pang iba. Marami pa, kaya mo yan. O kaya nyo yan, ha? Hindi ko na iisa-isahin yan. Assessment yan. Meron kayong HA na subject. Alam ko yon. Tama ba po? May HA kayong subject, di ba? O yan, alam nyo na yan. So these are the arteries. And what is the largest artery? The largest artery is the aorta. Very good. That's the largest artery. Okay, and then we have the veins. Okay, we have the veins. Okay, the veins are distributing vessel also. Meron din ba siyang smooth muscles? Meron din. Kaya lang meron siyang thinner tunica media, unlike the arteries. So it has a lower pressure inside. Kaya kapag nabutas ang vein, ang characteristic type ng bleeding niya ay oozing. Okay, pag artery yan, spurting. Pag vein yan, oozing. Okay? And the veins carry unoxygenated blood back to the heart. Tama ba? Dahil mas mababa ang pressure sa loob, walang pulses yan. Kaya yung pulses, it's created only by the arteries. Very good. Dahil mas manipis yung kanyang wall for the muscles, mas maluwag at mas wider yung kanyang lumen. This is the reason why the veins are called the capacitance vessels. Okay, and what is the largest vein? What is the largest vein? The inferior vena cava. Very good. So the largest artery is the aorta and the largest veins are the inferior vena cava. Very good. Pero pag tinanong kita, anong mas malaki? Yung aorta o yung inferior vena cava? Yung inferior vena cava, very good. Inferior vena cava na kasi yung lumen mas wider kasi manipis yung wall, so the lumen is wider. So the largest vessel is your inferior vena cava. Okay? Magbabasa kayo ng Brunner and Sodart, ha? Class, please follow all my instructions with you and Ma'am Nicolas's instruction. Kasi this is for you, this is not for me. Wag kayo mag-google. Wag mong i-google yan. I-Brunner mo yan. And I want you to read your books. Alam niyo kung nasa school tayo, you are required to bring your books every meeting. Pero nasa online tayo So wala. I just need to trust you that you are really reading your books kasi that's for you, ha? Basahin yung libro. Okay, so the arteries and veins are distributing vessels. Ulitin natin. Arteries distribute oxygenated blood to different parts of the body except pulmonary artery. And the veins will bring unoxygenated blood back to the heart except pulmonary vein. Pero may isa pa tayong vessel. Ang tawag natin, capillaries. Capillaries are very small in diameter. Okay? Maliliit lang siya. And they are not distributing vessels. They don't distribute blood. Okay. Maliliit lang yan kasi it only has the tunica intima. So ang nipis lang yan, ma'am. Correct. Dahil manipis yan, this is where actual exchange of gases and nutrients are taking place. So these capillaries, we call them exchange vessels. So ang tawag natin dito, exchange vessels. Okay, so this is your tunica intima. Kaya yung capillaries, hindi siya distributing vessels. Okay? Pero pinakamaliliit man yung capillaries na yan, class. Diba? These capillaries, class, have the largest surface area. It has the largest surface area. Kasi it occupies most of our body. So it occupies most of our body. So kahit saan ka tumusok sa katawan natin, merong capillaries doon. So it is the smallest in diameter, but it has the largest surface area because it occupies most of our body. Okay. Okay na yun. This is the anatomy of our blood vessels. Okay? So yung mga disorders nito, particularly disorders of the small and medium-sized arteries and veins, will be discussed with you. Nasa CO5 yun eh. Pero yung isa sa CO5, yung hypertension, i-discuss ko yun. Isasama ko yun sa CO1 at saka sa CO2. Okay? Okay. Are we learning? Do you have any questions? Learning ba tayo, class? Learning. Are we learning? Yes, very good. Okay. Can I change the page? Pwede ko na bang i-change ang page? Kumopya kayo, ha? Okay. O sige, yung iba ma'am, nakikinig muna po. Babalikan ko po yung notes kapag sa recorded video na. Pwede yun. Makinig ka muna, tapos pag pinanood mo yung recorded video, doon ka mag-take down ng notes. Pwede rin. O kaya naman, you can take down notes now, and then listen. And then when you go back to the recorded video, you know, you remember better. You listen again, diba? Okay, ayan. Maganda dito kasi nababalikan mo yan. Ayan, nababalikan siya, di ba? 1, 2, ayan. Dito na tayo. Now, let us discuss the heart. Ayan, dito na tayo sa anatomy ng heart. Mga anak, alam ko naman na alam nyo kung ano ang itsura ng heart. Alam nyo ba, nakakita na ba kayo ng picture ng heart? Yes. Yes, very good. Okay. Bakit ko tinatanong yan? Kasi hindi ko kayang i-drawing yan. So alam mo na yung drawing ko, hindi talaga gano'n yung heart. Representative lang yon. Maliwanag. Hindi ko kayang i-drawing yun eh. Okay, pero alam ko dapat, alam mo kung ano itsura ng aorta, anong itsura nito, etc. Ha? I trust you on that, ha? So the heart, this is my favorite organ. The heart is a hollow muscular organ located in the middle mediastinum, right between our lungs. Mediastinum, right between our lungs. Okay, nasa gitna ng lungs natin yan. Okay? Okay. Anong klase ng muscle yung heart? Sige nga, sagutin mo nga yan. What type of muscle is the heart? Cardiac, very good. I'm so proud of you. I like you, ha? So correct yan, ha? Cardiac muscle yan. Saan mo pa makikita yung cardiac muscles bukod sa heart? Wala na, huwag ka na mag-isip. Yan lang ang cardiac muscles. Okay, voluntary or involuntary? Yun, involuntary. Very good. Striated or non-striated? Striated or non-striated? Striated. Very good. Okay. So that this is the heart. And the properties of the heart are the following. O ano bang property? Unahin na natin yung best property niya. Ano ba yun? Muscle yan eh. Dahil muscle yan, natural, nagko-contract yan. So one property of the muscle is called contractility. Sa lahat ng tissues ng body natin, muscle lang ang nagko-contract. O remember the tissues of the body? Anatomy, 4 lang naman ang tissue natin. Ano nga yung mga tissue na yun? Muscular, connective, epithelial, at saka nervous. Sa lahat ng tissue na yan, muscles lang ang nagko-contract. Since the heart is a muscle, then it has a property called contractility. But you know what? Just like the nerves, the heart has a property called conductivity. It has the ability to transmit impulses. Do you remember what the pacemaker is? Sige nga. What is the pacemaker of the heart? What is the pacemaker of the heart? The pacemaker of the heart is the, yun, very good. The pacemaker is the SA node. Very good. So it has the ability to transmit impulse. Pag-uusapan natin yan later, ha? Pag-uusapan natin yung conductivity na ability ng heart na yan. Okay? Then what else? The heart also has the property called rhythmicity. Ayan. Meron siyang property called rhythmicity. It follows a particular or certain rhythm. Yan, rhythmicity. Okay? And the heart also has automaticity. Automatic yan. You don't need to tell your heart to pump every time it needs to pump. Promise. Otherwise, wala ka na gagawin kundi sabihin sa heart mo na mag-pump ka, mag-pump ka, mag-pump. Wala ka ng time para sa crush mo, di ba? And another one is called excitability. Okay. Ano ibig sabihin? Very excitable yan. Pag konting tusok mo lang dyan, may stimulate agad yan. Magre-react agad yan. Very excitable tong heart tissue natin. So these are the different properties of the heart. And there is only one function of the heart. Ano nga yung function ng heart na yan? Mag-pump ng blood. Wala nang iba. Wala na. It has nothing to do with loving. It has something to do with pumping. Tama ba ako? Am I right? Oo. Yan, participate in the, oo, yan. O mga anak, minsan natatawa ako, pero sana naman hindi ako natatawa sa sarili ko. So pag natatawa ka, pwede ka naman tumawa dyan sa chat box, ha? Oo naman, para hindi naman ako mukhang nag-iisang, alam mo mamaya pag nagising yung anak ko, sisilipin kayo, no? Sasabihin, mama, ano nangyayari sa iyo? Wala ka naman kausap dyan. Sabi ko, the heart, para magising, o naman, you know me, anak. Yung iba pala sa inyo, ngayon ko lang naging estudyante. Ito kasing sila Miss Napoles, na-handle ko yan eh. Oo, na-handle ko sila. So alam nila ako. I do not want malungkot sa lecture. Ang hirap na nga. Hindi ka pa tatawa. Gusto ko masaya. Kaya meron tayong motto sa MS1. There is so much fun in MS1. Oh. Para pag bumagsak ka man, masaya ka naman. Yun lang. Kailangan mahawa kayo sa tawa ko para naman magising kayo dyan. Malay-malay ko naman kung tulog na. Pasado daw yan lahat, Dok. Sigurado tayo. Okay. So, kailangan, ano lang ang function ng heart? Mag-pump. Wala nang iba. Mag-pump lang, ha? Sabi ng isang estudyante ko dati, Ma'am, dito ko po nararamdaman. Ito po ang tumitibok. Dito po ako nasasaktan, ma'am. Ito yung tumitibok. Ha? Sabi ko sa kanya, ang sagwa naman kung yung ulo mo yung tumitibok. Diba? Kaya dito tayo, yung heart, pump lang yan. Yung ulo, dun ka nagmamahal. Tama. Dito ka nagmamahal. Dito. Okay? Okay. This is the heart. Heart na yan. Huwag kang heart yan. At ang nagagandahan sa drawing ko, pumapasa. Ha? Maganda ba? Bilog lang heart yan. O ganda, thank you. O, diba? Very good. Diba? Thank you. Okay. Class. Kaya sinabi ko kanina, alam mo naman yung itsura ng heart. Kasi nga, hindi ko kayang i-drawing yon. So, ganito na lang tayo. This is just representative. O, tama, gandang-ganda kayo, di ba? This is the right atrium. This is the left atrium. Ayan. This is the right ventricle. Okay. And this is the left ventricle. O, alam mo na yan, ha? Alam mo yan, heart yan. Okay. And the function is to pump. Let us see. The right atrium receives blood from the upper portion of the body through the, what do we call this? Superior vena cava. O, di ba? Picasso. Superior vena cava. Okay. From the lower portion of the body, the right atrium will receive blood. Okay. From the lower portion of the body, unoxygenated blood will go back to the heart via the inferior vena cava. And from the walls of the heart, the right atrium receives blood through the coronary sinus. Okay. So the right atrium receives unoxygenated blood. Okay. Then the right atrium will pump blood to the right ventricle. Okay. Passing this valve. Diba? Meron tayong valve dito. What do you call this valve, class? On the right side, this is an AV valve. Anong tawag? Very good. On the right side, ang tawag ay tricuspid valve. Very good. What is the function of the valve? To prevent backflow. Very good. To prevent backflow. Okay. Then the right ventricle will pump blood to the lungs. Okay. It pumps blood to the lungs. Tama ba? Yes. Okay. Meron ka ring valve dyan. What do we call this valve here? Dito sa pulmonary artery. Pulmonary artery to. So ano ang valve dito? This is an semilunar valve. Very good. The semilunar valve on the right side, ang tawag ay pulmonic valve. Again, what is the function of the valve? To prevent backflow. Ulitin natin, ha? Unoxygenated blood is received by the right atrium, and the right atrium pumps blood to the right ventricle, passing this valve. What do we call the valve? Tricuspid valve. What is the function of the valve? To prevent backflow. Then the right ventricle will pump blood to the lungs. via the pulmonary artery. Lagyan natin ng name, pulmonary artery. The only artery carrying unoxygenated blood. Very good. And you have a valve here. Anong tawag sa valve? Pulmonic valve or pulmonary valve. That is also correct. Okay. And what is the function of the valve? To prevent backflow. Okay. Pagdating sa lungs, ano ang gagawin ng lungs? Oxygenation. Tama? Yes, and oxygenated blood will flow back the heart, pabalik yan ulit sa heart, via the pulmonary vein, via the pulmonary vein, the only vein carrying oxygenated blood. Very good. So we have the blood in the left atrium already, and the left atrium will pump blood to the left ventricle. Very good. Passing these valves. Ano ngayon ang tawag natin dito sa valve? The AB valve called. Very good. On the left side, ang tawag ay mitral valve. What is the other name for mitral valve? The other name, very good, bicuspid valve. Very good. Bicuspid valve. Again, what is the function of the valve? The function of the valve is to, what is the function of the valve? To prevent backflowing. Okay. Alam nyo ba, board exam question na yan, what is the other name for mitral valve? Sabi ko nga sa inyo, I am a national reviewer for the board exam. So malapit na yung board exam ng mga kuya natin at ate natin. I'm sure you know them, iba yung mga bagong graduates. So let us pray for all of them that they may be passing the exam. Hindi lang para sa kanila, para sa school natin, di ba? And syempre, para sa kanilang future. Ngayon ay naniniwala ako na ang pagpasa sa exam, hindi lang nakukuha sa review. Ito ay nakukuha sa 4 na taong pagsusumikap sa eskwelahan. So it's really Fatima that has laid foundation on all of you para pag kayo na ang mag-board, papasa ka din. Diba? Okay. So the left ventricle now will pump blood to the aorta. Okay. And this is now the aorta. Lagay natin, aorta. Okay. Tapos, may valve ka pa rin dyan. Yes, ito. This is another semilunar valve. Anong tawag dyan? Aortic valve. Okay, another semilunar valve on the left side. Ang tawag ay aortic valve. So again, the function of the valve is to prevent backflow. So the heart is actually pumping blood to circulation. Yung lungs, ang tawag natin, pulmonary circulation. Okay. At yung dito, ang tawag natin ay systemic circulation. Okay. So the pulmonary circulation and the systemic circulation. Class, which has a higher pressure? Ano ang mas mataas na pressure? Pulmonary or systemic? Anong mas mataas? Systemic. Okay. And the pressure here, yung pressure natin sa systemic circulation, yun yung blood pressure natin. Kaya yung average niyan, class, is about 110/70. This is our average systemic pressure. Sa pulmonary pressure, the average pulmonary pressure is about 25/9 millimeters mercury. But we don't measure it directly. Hindi natin na measure directly yan. Okay? So this is actually being measured by cardiac catheterization. So it is by cardiac catheterization that we measure the pulmonary pressure. Okay? Yan yung average. So again, the heart is pumping blood to circulation, the systemic and the pulmonary circulation. And you are seeing the valves there. Okay? What is the function of the valve? Again, to prevent backflowing. Okay, so nagsasara pala ma'am at nagbubukas yung mga valves na yan. Yes, and when these valves close, they produce heart sounds. When these valves close, they produce heart sounds. Okay, heart sounds. Okay, meron tayong 4 heart sounds class. We have 4 heart sounds. Okay, ano-ano ba yung mga heart sounds natin? The first heart sound is loud. Okay, and this is caused by closure of the AB valves. The closure of the AB valve. Okay, very good. Then we have the second heart sound is the dub. Okay, and this is caused by closure of the semilunar valves. Okay, so when these valves close, they produce heart sounds. So this first heart sound and second heart sound, they are called audible sounds. For a while, class. Okay, sorry for the interruptions. Again, when they close, ayan, they produce heart sounds. Itong first heart sound and second heart sound, ang tawag dyan, audible heart sounds. Nadidinig mo using the bell of your stethoscope. Okay, pero yung dalawang heart sounds, the S3 and the S4, inaudible. Hindi natin naririnig. Okay, lagay ko muna. Inaudible, pero nadedetect ng machines natin. Okay, so this one is called the S3. Ano nga yung S3? This is caused by rapid ventricular filling. Mamaya i-discuss ko to when we talk about cardiac cycle. Okay, para makita mo kung ano ba yung S3 sound na inaudible. And then we have the S4, which is caused by atrial systole. Plus, pag sinabi nating systole, contraction. Pag sinabi nating diastole, relaxation. Okay, so these are the different heart sounds. Okay. Again, ano nga yung AB valve, tricuspid, tsaka bicuspid. Ano nga yung AS, semilunar valve, pulmonic valve, tsaka aortic valve. Okay. So sila, pag nagsasara, nagke-create sila ng heart sounds. Okay. O makinig, ma'am, paano gusto namin marinig yung mga closure ng valves, okay? Paano natin siya ma-assess, okay? So let's review back our valvular assessment. So yung valve assessment natin, valvular assessment. Okay, paano ba tayo mag-assess? Using the bell of your stethoscope. Bell ha, bell. Alam mo yun? Ma'am, yung stethoscope ko walang bell, yun nga lang. Using the bell of the stethoscope, okay, auscultate. For you to be able to hear the valves, auscultate. Auscultate. Saan? Ba gusto mong marinig? Gusto kong marinig yung closure ng aortic valve. So saan ka mag-auscultate? Auscultate at the second intercostal space, left. Right parasternal area. Right parasternal area. Right, dito. Second intercostal space, right. Parasternal area. Anong gusto mong marinig dyan? Aortic valve. First heart sound o second heart sound? Okay. Dali. First heart sound o second heart sound? Sagot sa chat box. Sagot. First heart sound o second heart sound? Aortic valve. Aortic valve. This is a semilunar valve. Semilunar valve. Again, first or second? First or second? Very good. Okay. Gusto kong marinig ang pulmonic valve. Pulmonic valve. O di ba maganda yung may kausap ako kaysa nagle-lecture akong mag-isa sa video, wala akong kausap. So you hear this when you auscultate at the second intercostal space, left parasternal area. Left, pulmonic, 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 pulmonic. First heart sound o second heart sound? Very good. Ang husay. So, if you're going to see my chest, I'm going to see your, muna ha. Baka kung anong kita natin. So, you will hear the second heart sound here. Right, aortic, left, pulmonic. Aortic, pulmonic. This is the second heart sound. So, ang naririnig dito ay dub. Okay, very good. Ayan. Okay, ang gusto kong marinig yung tricuspid valve. Tricuspid valve, okay. Saan ka mag-auscultate? Auscultate at the fourth intercostal space, left parasternal area. Left parasternal area. The fourth intercostal space, left. Okay. Nalabo pala. Aortic, pulmonic, tricuspid. Aortic, pulmonic, tricuspid. Okay. So that is your fourth intercostal space, left parasternal. First heart sound o second heart sound? Nauna na si anak ko. Sabi niya first heart sound. Very good. And then I would like to listen to the mitral valve. The mitral valve is heard over the fifth intercostal space. Yung ibang libro sabi nila between fifth and sixth intercostal space. Okay lang yan. Between fifth and sixth intercostal space, left mid clavicular line. Left mid clavicular line. So ito yung clavicle mo sa gitna ng clavicle, mid clavicular line. So nasaan yung apex? Sabi niya mid clavicular line. So nandito, aortic, pulmonic, tricuspid, mitral. Ayan. Aortic, pulmonic, tricuspid, mitral. So anong naririnig mo doon? The first heart sound, loud. Alam mo ba, the sound of the mitral valve class is actually the point of maximum or maximal impulse. Ito yung tinatawag nating apical pulse. Okay? Bakit? Kasi yan ang tinatawag nating apex. So the sound that you hear in the apex, the point of maximum impulse is actually the closure of the mitral valve. Oo, ayan anak, tama. Diyan po ang apical valve. Yes, that's correct anak. Very good. You are right. Okay? So this is the apex of the heart. Okay? So this is how we assess our valves. Dapat nagsasara siya to prevent backflow. Ma'am, pag hindi nagsara yung valves, ano mangyayari? Di may backflow. Pag may backflow, what do you hear? Kapag may backflow class, ayan, pag sira yung valve na yan, anong maririnig natin? May backflowing. And the backflowing, you hear characteristic murmur. Pagka nagkaganito yung iyong heart sound, so lub-dub-sh, 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 nagba-backflowing kasi. Kaya may murmur. So pag sinabi nating murmur, ano to? There is increased turbulence in the flow of blood through the heart. So pag nakakarinig tayo ng murmur, okay. Pag nakarinig ka ng murmur, okay, anong meron? Abnormal valves. There. Do you understand? Naintindihan ba? Very good. Learning tayo. Learning. Very good. Yan. Okay. Now, let's move forward. Can I now go to the next page? This is the contracting ability of the heart. Contractility. The heart contracts. Okay? Yes. Okay. Very good. Let's now go to the next page. Let's talk about the heart conductivity. Okay, pag-usapan natin yung conductivity. Okay. Ano ba yung conductivity? Conductivity is the ability to transmit impulses. Ability to transmit impulses. Di ba ma'am, mga nerves ang nagtatransmit ng impulses? Nako, yung heart din nagtatransmit ng impulse, di ba? Pinag-usapan na natin to kanina. This is the heart. Sabi natin, what is the pacemaker? The SA node. It is the SA node that initiates an impulse. And this impulse will travel all throughout the heart. Diba? Sabi natin, this is your SA node. Kandahan natin, gawin natin pink. Ayan. This is your SA node. This is the pacemaker. This is between the superior vena cava and the right atrium. Okay. Then, this is the AV node. Okay. The atrioventricular node. Then we have the bundle of His. Ayan. We have the bundle of His. Then we have the right and the left branches of the bundle of His. The right and the left branches of the bundle of His. And finally, we have the Purkinje fibers, di ba? We have the Purkinje fibers. I'm sure alam niyo naman yan. Anong tawag natin dito? Ang tawag natin dito ay the conducting system of the heart. Conducting system of the heart. Diba? Yung sa anatomy book natin, ang tawag nila dyan, ang tawag niya dyan, nervous system of the heart. Oh, meron daw siyang sarili niyang nervous system. Okay? Okay na sa akin yun. Kasi yung anatomy natin, it simplifies things for all of us. Diba? Meron siyang sariling nervous system. Naalala ko tuloy yung napanood ko sa FB. Yung pamisa-misan pag may time, nagpa-browse ako sa FB. Siguro napanood nyo rin yun. Tawa ko ng tawa. Sabi dong ini-interview, how do you feel right now? Sabi, I feel nervous. Sabi niya, I think it's okay to feel nervous because we have nervous system. So, pati ba yung heart mo may nervous system? So, it's okay to feel nervous. Do you agree? Natawa talaga ako dun. Sabi ko, nga naman, But I'm going to think about it. Sabi ko, it makes sense. It makes sense. Oo, kasi para na-justify yung iyong pagiging nervyoso. So, this is your nervous system of the heart. Okay. Lagyan natin ng label. Lalagyan natin ng label. Lahat dapat may label. Muhugot ka ha. Dapat lahat may label. Huwag kang papayag na wala kang label. Ha? Kakaloka ka. Ba't ka pumapayag na wala kang label? Dapat may label ka. Ito ang SA note. Ayan, may label. And then this is your, ang sakit daw. Ba't wala kang label, anak? Uy, magkapapayag. This is your AB note. Hanggang friend lang daw. Yun lang. Okay. At least alam mo na friend zone ka agad. Diba? Huwag kang mag-alala, anak. Bata ka pa. Sabi mo sa kanya, pag ako naging nurse, ha, huyo ka sa akin. Okay. Ano to? This is your bundle of his. Okay. Ito bundle of his muna. Nagmamadali ka naman, anak eh. Bundle of his. And then we have the right and left bundle. Lagay ko na lang dito ha. The right and left branches. Ayan. And finally, the Purkinje fibers. Ayan. So anong tawag dito? The conducting system. Anong ginagawa nila? Nagtatransmit ng impulse. Okay. So the SA node initiates an impulse and the impulse travel to the AV node, diba? And this impulse will travel to the bundle of his, to the right and left branches, and finally to the Purkinje fibers. Okay, so ito ay nagtatransmit ng impulse. Anong tinatransmit nun? Electrical activity o mechanical activity? Go. Electrical activity. Very good. Will this electrical activity stimulate the muscle to contract? Yes, very good. So how do we transmit impulses? Para palang nerve yung heart natin, no? Nagtatransmit ng impulses. How do we transmit impulses, no? Impulses are transmitted by what we call action potential. Action potential. I'm sure narinig mo na to. Dinidiscuss to sa anatomy, dinidiscuss to sa pharma, o didiscuss ko ulit. Sana naman maintindihan mo na, ha? So what is an action potential? An action potential is a rapid change in the membrane potential. It is a rapid change in the membrane potential. Isang mabilis na pagbabago ng membrane potential. Paano yun? Okay. Plus, di ba, we are talking about conductivity. This is the major property of the nerves. So, merong nerve yan, function ng nerve, function din yan ng muscles, particularly the heart muscles. Okay. Let me discuss first conductivity in the nerves. Sa nerves muna tayo, ha? Nerves muna, nerves muna, nerves muna. Tapos mamaya we will talk about the conductivity in the heart. Is that okay? Is that okay? Okay, very good. So dito muna tayo sa nerves, sa nerves, sa nerves. So, para mas maintindihan natin, class, halimbawa, kinurot ko to, kurot, yan. This is a stimulus, okay? This is a stimulus, alright? And this stimulus, class, ayan, yung kurot, okay, this will stimulate the nerve and the impulse will travel to the nerve hanggang nervous system, right? And how do impulses travel? Impulses travel by action potential. What is an action potential? A rapid change in the membrane potential. Teka muna, ano ba yung membrane potential? What is a membrane potential? Sige, imagine natin to. Imagine mo to, may kwento ako ha. Minsan ang mga kwento, madaling maalala pag walang kwenta. Correct. Oo, correct. Sige. Halimbawa ha, halimbawa, may nakita kang bata. Yung bata, nahawakan niya yung kuryente. Ano nangyari sa bata? Nakuryente yung bata. Nakita ng nanay, hinawakan yung bata. Teka, ano mangyayari sa nanay? Ay, makukuryente rin si nanay. Ay, nakita nung tatay, hinawakan ng nanay. Ano mangyayari kay tatay? Makukuryente rin po. Very good. So, tatlo na silang nangingisay doon. Okay, class. Makinig ka ha. Makinig ka parang chain. Is it possible that electricity will pass from one body to another? Yes, kaya pag may nakukuryente, huwag mong hahawakan. Bakit? Lilipat sa iyo yun. Bakit ba lumilipat sa atin yun? Bakit nga ba? Bakit? Because our cells, class, have electrical charge. May kuryente tayo. Sa buhok daw po hawakan. Huwag mong hawakan. Patain mo yung kuryente. Okay. Ito yung cell natin. Cell to cell. Nilagyan ko lang ng nucleus. Ha? Oo. Pwede bang tanggalin ko na yung nucleus? Tatanggalin ko na yung nucleus kasi storbo siya. Hindi, lagyan natin ng nucleus, kanya na lang. Okay. So halimbawa, ito yung cell natin. Okay. Bakit ba tayo nakaka-transmit ng electricity? Kasi yung cell natin, our cells, okay, ano ba yung cells natin? Yung ating intracellular fluid compartment, the ICF and the ECF, ayan, meron tayong ions, okay. Ions, okay, na positively charged. Anong tawag sa ions na positively charged? Cation, very good. At saka negatively charged. Ions that are negatively charged. Anong tawag doon? Anions. Ayan. Meron tayong cations tsaka anions. May mga charge sila? Oo naman. At anong sabi sa atin? What is the major cation outside the cell? The major cation outside the cell is sodium. May sodium ka rin sa loob. Kaya lang, mas konti. Okay? What is the major cation inside the cell? The major cation inside the cell is potassium. Meron ka rin sa labas, kaya lang mas konti. Very good. Thank you for answering and replying. I like your group, ha? Sana lahat ng group ganyan, ha? So natin matuto, ha? Okay. What is the major anion outside the cell? It is the chloride. May chloride ka rin sa loob, kaya lang mas konti. Okay. Saan mas marami ang calcium? Sa labas. Okay. May calcium ka rin sa loob, kaya lang mas konti. So do we have differences in the concentration of cation and anion in and out of the cell? Again, do we have differences in the concentration of cation and anion in and out of the cell? Yes. And that concentration difference create an electrical charge. May kuryente tayo. Parang baterya ang cell natin. Meron tayong negative pole and positive pole. If you're going to think about it, yung baterya rin ang tawag cell eh. Promise, tama? Oo, meron siyang negative pole and positive pole. And because of the differences in the concentrations of cation and anion in and out of the cell, we create an electrical charge that is negative inside the cell membrane. Yung negative pole natin nasa loob ng cell membrane and the positive pole is outside. Okay, so we have negative pole and positive pole. Okay, negative pole and positive pole. So negative. So may kuryente tayo, meron. Para tayong mga baterya, para tayong mga switches. Okay. Ma'am, question, kung meron tayong electrical charge, meron din tayong voltage? Oo, may voltage din tayo. What is our electrical charge? Our electrical charge will range from negative 60 to negative 90 millivolt. This is our electrical charge. May kuryente tayo. Nakasunod ka? Nakasunod tayo? Yes, may kuryente tayo. Okay. Very good. From negative 60 to negative 90 millivolts. This is an electrical charge. Okay. Class, we don't call it electrical charge. Hindi natin tinatawag na electrical charge to. Anong tawag dyan, ma'am? Ang tawag dyan, membrane potential. So pag sinabi mong membrane potential, we're actually referring to the electrical charge. Nakasunod po? Yes. Okay, very good. So ulitin natin yung sample ko ha. Sample ko, sabi ko, kinurot ko yung kamay, kurot. This is a stimulus. And this stimulus will travel from the hand to the nervous system, correct? And how do impulses travel? Impulses travel by action potential. What is an action potential? A rapid change in the membrane potential. Rapid change in the membrane potential. Mabilis na pagbabago ng membrane potential. Ano yun? Paano yun? Okay. Rapid change. Okay. Pag-usapan natin yung rapid change. Okay. Tayong lahat ay meron tayong cellphone. Diba? Okay. May cellphone tayo lahat. Plus tell me, is it okay for us to charge the phone even if the phone is off? Pwede ba yun? Yes. Okay. So, nag-empty bat yung cellphone mo, chinarge mo, pero hindi mo tinurn on, patay yung cellphone. Okay? Try to imagine that so we can understand this better. Tapos, ano nangyari? Nag 100% battery. Yan. Full charge. Okay. Tapos, tinanggal mo na siya sa charger. But you did not turn your cell phones on. Iniwanan mo siya sa mesa. Pero patay yung cellphone mo. Patay yung cellphone, pero may charge yun. Nakasunod ka. Okay, very good. Okay. Yung cell natin, hindi ko pa siya kinukurot. Hindi ko pa siya kinukurot. Hindi ko pa siya na-stimulate. May charge na to. Very good. Ang tawag natin doon sa electrical charge of the cell, even if the cell is not yet transmitting an impulse, ang tawag doon, resting membrane potential. Again, anong tawag? Resting membrane potential. Resting membrane potential. Okay. The electrical charge of the cell at rest. The electrical charge of the cell at rest. The electrical charge of the cell at rest. Hindi pa siya nagtatransmit ng impulse. Nakasunod ka? Okay, very good. Okay. All right. Oh, sorry po ha. Sorry for the interruption. Okay. O, nasa na ba tayo? Sabi natin, kahit hindi pa natin kinukurot to, may charge na to. Tama ba? Okay. Yung cellphone natin, hindi pa natin binubuksan, pero charge. Tama? Sunod? Okay, very good. So anong ginawa natin? Tinurn on natin yung cellphone natin. Nung tinurn on na yung cellphone natin, you started browsing already. Binuksan-buksan mo na yan. Binuksan-buksan mo na. Charge mo ng ganyan. Okay? You turn it on. Sandali lang. May tumawag ba? Sorry. Nag-ML ka na, nag-browse ka na, nag-FB ka na. Okay, halimbawa lang ha. Okay, well, you are doing that to your cell phones class. You tell me, 100% pa rin ba ang charge nun? Habang ginagalaw mo yun, 100%, hindi na ma'am, 99.9 na lang, 98, 97, mamaya wala pang 2 minutes, 97, 95 na lang, 80 na lang. Yung iba nga, kapag bukas pa lang ng cellphone, 50 na lang. O ha, sira na yung battery. Okay, di ba? So nagkaroon ng ano? Nagkaroon ng rapid change. Kasi binuksan mo. Nakasunod ka? Nakasunod? Nakasunod? Yes. Okay, very good. So tignan natin ha. Ano nga nangyayari? Okay. Tignan natin to ha. Suppose ito yung nerve. Nerve to ha. Ito yung nerve. Ayan. Ito yung nerve. Ayan. Okay. Tapos yung nerve natin, ano nga? Meron kang negative sa loob. Negative sa loob. Ayan. Negative sa loob. Ayan. At saka positive sa labas. Ayan. Positive sa labas. Okay, tama ba? Ganyan yung ating electrical charge, di ba? Okay, example, the resting membrane potential. This is the resting membrane potential at rest. Halimbawa, it's negative 90 millivolt. Example, negative 90 millivolts. Please follow. Pag hindi naintindihan, sabihin sa akin. Ha? O, tapos anong ginawa natin? Ang ginawa natin, class, in-stimulate natin. We stimulated the nerve. Kinurot natin siya. Kurot. Okay. Parang yung cellphone mo, tinurn on. Okay, that's a stimulus. So what will happen? O, makinig ha. Pag kurot natin yan, okay, what happens? Nagbukas ang mga sodium channels. The sodium channels open. Dahil mas maraming sodium sa labas kaysa sa loob, by simple diffusion, anong ginawa ng sodium? Sodium enters the cell. Eh ano ba yung sodium? Cation o anion? Cation yun. Cation. Okay? So kung cation yung pumasok, what will happen to the electrical charge? Will it become more negative or more positive inside the cell? Again, more negative or more positive? It becomes what? More negative or more positive? Cation yung pumasok eh. Negative yung nasa loob. Pumasok yung cation. Ano yung cation? Positive yun eh. Sodium positive yan eh. So what will happen to the inside of the cell? Again, more negative or more positive? It becomes yun. Pumasok yung positive eh. So it becomes more positive. When the membrane potential becomes more positive, anong tawag doon? Ang tawag doon, depolarization. Again, ang tawag doon ay depolarization. Nakasunod tayo? Nakasunod? Nakasunod? Okay. After the sodium channels have open class, after the sodium channels have open, what will happen? After the sodium channels have open, potassium channels naman open. Saan ba mas maraming potassium? Sa loob. Okay, dahil mas maraming potassium sa loob kaysa sa labas, anong nangyari sa potassium? Potassium, pumasok o lumabas? Lumabas, out of the cell. Di ba ang potassium cation din? So cation ang pumasok, cation din ang lumabas. So kung cation din yung lumabas, what will happen to membrane potential? Will it become more and more positive o babalik na ba siya sa more negative? Sagot. Pag lumabas yung potassium, ayan, it goes back to more negative. Back to resting. Back to resting. Anong tawag doon? Ang tawag doon ay repolarization. Very good. Repolarization. Okay. So therefore, the impulse now have traveled from this point to this point. Okay. Sodium in, potassium out. Do you have a change in the membrane potential here? Yes. So ano nangyari? Yung sodium dito, nag-open ulit. Yung potassium, nag-open ulit. So what happens? Sodium in, potassium out. Depolarization, repolarization. Sodium in, potassium out. Depolarization, repolarization. Sodium in, potassium out. Depolarization, repolarization. Nag-travel ba ang impulse? Yes, very good. So the impulse have traveled from this point up to this point. Did you get it? Okay, that's well. Okay, so again, the impulse travel from this point up to this point. So how do impulses travel? By action potential. What are the phases of action potential? Sodium in, potassium out. Sodium in, potassium out. Let us put it in a graph. Ilalagay ko sa graph ha. So suppose this is the graph. Lagay natin sa graph. Okay. Okay. Suppose this is the graph. Okay. Then this is our resting membrane potential at negative 90 millivolt. This is your resting. Ibig sabihin, the nerve is at rest. Okay. Anong ginawa natin? Kinurot natin yung nerve. So nung kinurot natin yung nerve, what happens to sodium channels? Open. Okay, nag-open ang sodium channels. Anong ginawa ng sodium? Pumasok, lumabas. Pumasok, lumabas. Pumasok. Very good. So what happened to the membrane potential? More negative or more positive? More positive. Anong tawag doon? When the membrane potential becomes more positive, anong tawag doon? Ang tawag ay depolarization. Depolarization. Are we following? Yes, and then after the sodium channels have opened, ano nangyari? The potassium channels open. Potassium channels open. So nung nag-open ang potassium channel, anong nangyari? Bumalik na siya sa resting. Bumalik na siya sa resting. So potassium channels open. Anong ginawa ng potassium? Lumabas naman yung potassium. Cation ang pumasok. Cation din naman ang lumabas. So what happens to membrane potential? It goes back to resting. Ano naman ang tawag dyan? Ang tawag dyan ay repolarization. Repolarization. Okay. Ay, ma'am, paano pag lumagpas? Okay. Potassium channels are very slow channels. Matagal magbukas, matagal din magsara. So, minsan, andito ka na, lumalabas pa ng lumalabas yung potassium. So paglabas pa ng labas yung potassium, the membrane potential goes beyond resting, beyond resting, beyond resting. Class, kapag beyond resting, ang tawag doon, hyperpolarization. Beyond resting, hyperpolarization. Class, when the nerve is in hyperpolarized state, hindi natin siya kayang stimulate. Kailangan muna niya ulit bumalik sa resting para ma-stimulate natin ulit ang nerve. Again, when the nerve is in hyperpolarized state, we cannot stimulate the nerve. Kailangan muna niyang ulit bumalik sa resting para ma-stimulate natin siya. Did you get it? Okay, very good. Sa nerve po yan, ma'am. Yes, sa nerve to. Nerve, nerve, nerve. Okay, let's talk about the heart. Okay, can I change now? Next page. Can I change? Next page. Okay, very good. Let's talk about the action potential in the heart. Let's talk about the action potential in the heart. Heart muna tayo. The action potential in the heart. Okay. Gawin na natin siyang graph. Let's put it in a graph already kasi alam naman na natin yung conducting system. Gawin na natin agad na graph. Okay. So suppose the resting membrane potential in the heart is negative 60 millivolt. Halimbawa, this is the resting membrane potential. Teka lang nga, iusog natin. Ayan, that's the negative resting membrane potential. Class, what is the pacemaker? The pacemaker is the SA node. When the SA node initiates an impulse, sodium channels open. Sodium channels open. Anong ginawa ng sodium? Pumasok ang sodium. So what happened to membrane potential? More positive or more negative? More positive. Pag more positive, anong tawag doon? Depolarization. May depolarization din pala sa heart? Of course. Pero sa heart muscle class, hindi lang sodium at potassium ang nag-o-open. Sa heart muscle class, nag-o-open din ang calcium. The calcium channels open. So pag nag-open ng calcium, okay, anong gagawin ng calcium? Dahil mas maraming calcium sa labas kesa sa loob, papasok yung calcium. And this is the reason why the action potential in the heart creates a plateau formation. The action potential in the heart creates a plateau formation. Nag-plateau. Ma'am, bakit kasali yung calcium kapag sa heart? Kasali yung calcium sa heart kasi kailangan pumasok ng calcium sa loob ng cell ng heart because calcium is needed for muscle contraction. Yung heart kasi natin, muscle. Yung nerve, hindi kailangan ng calcium entry kasi hindi naman nagko-contract yung nerve. Yung muscles, nagko-contract. Did you get it? Okay, very good. Now, after the calcium channels have opened, the potassium channels open. So, potassium channels open. Anong ginawa ng potassium? Lumabas ang potassium. So, nung lumabas ang potassium, cation yung pumasok, cation din ang lumabas. So, what will happen to membrane potential? It goes back to resting. When it goes back to resting, anong tawag doon? Ang tawag doon, repolarization. So sa nerve, paano nga tayo nagtatransmit ng impulse sa nerve? Sodium in, potassium out. Sodium in, potassium out. Sa heart muscle, paano tayo nagtatransmit ng impulse? Paano? Sodium in, calcium in, potassium out. Sodium in, calcium in, potassium out. Okay? Sodium in, calcium in, potassium out. Bakit kailangan kasali yung calcium? Because calcium is needed for muscle contraction. Class ano to? Electrical activity o mechanical activity? Ano tong pinag-uusapan natin? Electrical activity o mechanical activity? electrical activity. Can this electrical activity stimulate the muscle to contract? Yung muscle contraction, yon ang mechanical activity. Ngayon, kung electrical activity to class, can we see this on ECG? Ano nga yung ECG? Electrocardiogram. Okay, can we see this on ECG? Yes, very good. So how do we see that on ECG? Suppose this is ventricular contraction, ventricular depolarization. You see that on ECG as QRS. Ventricular depolarization, ventricular repolarization. We see this on ECG, hindi graph. We see this on ECG as waves. O sige, we have the QRS wave. Ano to? This is ventricular depolarization. Okay. Then the U wave, the T wave, this is ventricular repolarization. Ventricular repolarization. So again, ano nga to? Electrical o mechanical activity? Electrical activity. Can we see this on ECG? Yes. You see them as QRS, then this is T wave. Okay. This is QRS. QRS. Ayan. Then this is T wave. Electrical o mechanical? Electrical. Okay. Balikan natin yung heart. Balikan natin yung heart. This is the heart again. Okay. What is the pacemaker? The pacemaker is the SA node. Yan. Okay. Lagyan natin ng SA node. Lagyan natin ng AV node. Okay. This is your AV node. Okay. Makinig ha. When the SA node initiates an impulse travel to the AV node. When the impulse travel to the AV node, question, nagkaroon ba ng atrial depolarization? Yes. Nagkaroon ba ng atrial repolarization? Yes. Ano nga to? Electrical activity. Will this stimulate the atria to contract? Yes. When impulse travel from AV node to the bundle of His, to the right and left branches, to the right and left branches, okay, up to the Purkinje fibers, okay. Ano nangyari? Nagkaroon ng electrical activity, nagkaroon ng ventricular depolarization and followed by ventricular repolarization. Again, is this an electrical activity? Yes. Do we see them on ECG? Yes. The atrial depolarization is seen on ECG as P wave. The atrial depolarization is seen on ECG as P wave. Ma'am, nakikita ba ang atrial repolarization sa ECG? No. Bakit hindi? Kasi yung atrial repolarization at saka yung ventricular depolarization, they occur at the same time. Nagsabay sila. Okay, same time yan. Dahil mas malaki ang ventricle kesa sa atria, ang nakita natin sa ECG, ventricular depolarization, which is your QRS. Then the ventricular repolarization is seen as T wave. Ulitin natin. Ba't hindi natin nakita yung atrial repolarization? Kasi nagkasabay ang atrial repolarization tsaka ventricular depolarization. Dahil mas malaki ang atria kaysa sa ventricle, ang nakita natin sa ECG ay ventricular depolarization. So if you're going to see the ECG, sorry, I cannot draw very nicely. So this is your P wave, P, QRS, T. Okay, so this is P, this is QRS. Okay, and then this is T wave. Ano nga ulit yan? Electrical o mechanical activity? Electrical activity. Will this stimulate the muscle to contract? Okay. So when impulse travel from SA node to AV node, the electrical activity stimulate the atria to contract. So the P wave here represents an electrical activity in the atria, and this may also represent atrial contraction. When impulse travel from AB node to Purkinje fibers, you see a QRST class, and this is followed by ventricular contraction. Isang contraction ng atria, isang contraction ng ventricle, again. Isang contraction ng atria, isang contraction ng ventricle, that is one heartbeat. So pag nakakita pala tayo ng isang PQRST, will this represent one beat of the heart? Very good. So pag nakakita tayo ng abnormal ECG, abnormal ba ang heartbeat? Yes, very good. Again, the electrical activity stimulate the muscle to contract. Pag normal ang electrical activity, normal ang heartbeat. Pag abnormal ang electrical activity, abnormal ang heartbeat. Paano ba yung heartbeat? Isang contraction ng atria, isang contraction ng ventricle, that is one heartbeat. Isang contraction ng atria, isang contraction ng ventricle, that is one heartbeat. Are we following? Okay. Okay, and how many heartbeats per minute is normal? Okay, so isang contraction ng atria, isang contraction ng ventricle, this is one heartbeat. And how many is the normal? Normal is about 60 to 100 beats per minute. 60 to 100 beats per minute. Isang contraction ng atria, isang contraction ng ventricle, that is one heartbeat. And this is the normal heartbeat. Class, yung isang heartbeat represents one cardiac cycle. One, lagay natin one. One heartbeat represents one cardiac cycle. One heartbeat represents one cardiac cycle. Do you understand? Okay, yeah. I said one heartbeat is one cardiac cycle. Diba sabi natin, pag sinabi natin cardiac cycle, ano ba yon? Cardiac cycle refers to events. Okay, events taking place in the heart, in one heartbeat. Again, cardiac cycle refers to events taking place in the heart in one heartbeat. You know, ang bilis lang ng isang heartbeat. It is, I think, more or less than 0.8 seconds. Ganun lang siya kabilis. And these are the events taking place in one heartbeat. Okay, so what are these events? Sulat muna natin yung events, no? Tapos, i-describe natin siya isa-isa. Pag sinabi kong cycle, syempre, ikot lang tayo ng ikot. So, kahit saan tayo mag-umpisa, doon din tayo babalik. Diba? Kasi it's a cycle. So, kung saan tayo nag-umpisa, doon din tayo babalik. Right? So, these are the different events. Okay, let's start off with atrial systole. Okay, then this is followed by isovolumetric ventricular contraction. Okay, then this is followed by maximum ejection. Then this is followed by isovolumetric ventricular relaxation. And this is followed by diastasis. Yeah, so these are the different events in the cardiac cycle. Again, atrial systole, isovolumetric ventricular contraction, maximum ejection, then isovolumetric ventricular relaxation, and finally, diastasis. So how does this cardiac cycle happen? Paano ba nangyayari itong cardiac cycle? Paano ba nangyayari ito? Okay, let us have the heart again. Okay, this is the heart. Ayan. This is the heart. Okay, sabi natin, when SA node initiates an impulse, the impulse will travel to the AV node, and that impulse will stimulate the atria to contract. So atrial contraction is called atrial systole. Again, atrial contraction is atrial systole. So what happens? Lahat ng blood dito sa atria bumaba sa ventricle. Tama? Yes. And this is followed by closure of the AV valve to prevent backflow. Very good. And the closure of the AV valve will produce the first heart sound. So the first heart sound happens after atrial systole. Nakasunod ka? Nakasunod tayo? Following? Sunod? Okay, very good. Okay. Tapos this is our right ventricle. Okay. This is our left ventricle, di ba? Sabi natin. Okay. Ito yung aorta. This is the aorta. Okay. This is the pulmonary artery. Ayan. Tapos ito yung aorta. Ito yung pulmonary artery. Sulatan natin. This is the aorta. Okay. This is the pulmonary artery. Okay. Ayo ha, makinig. Okay. When the atria contracts, the blood flows to the ventricle. So, dumami ba ang laman ng ventricle? Yes. Okay, very good. Pero yung valves dito, sarado pa. Sarado pa ang valves. Okay. So, ulitin natin ha. Sarado pa to, sarado pa to. Nagsara to, nagsara to. Sarado ang valves. Marami bang laman ang ventricles? Yes or no? Yes. Mataas ba ang pressure sa ventricle? Yes, very good. When all valves are closed and the pressure in the ventricle is high, ang tawag doon, isovolumetric ventricular contraction. Ulit. When all the valves are closed and the pressure in the ventricle is high, anong tawag doon? Ang tawag doon, isovolumetric ventricular contraction. Ulit. When all the valves are closed and the pressure in the ventricle is high, anong tawag doon? Isovolumetric ventricular contraction. It's okay, anak. Malakas ang ulan. But dito maaraw na. Okay? O, makinig ha. Tumataas na po ang pressure sa ventricle. Mataas ang pressure sa ventricle. Tama ba? When the impulse travel from AV node to the Purkinje fibers, ventricles contract. Ventricles contract. Pag nag-contract ang ventricle, anong mangyayari sa valves? The valves here, itong valves na to, ito sarado to ha. Ito sarado to. Itong valves na to, magbubukas. So pag nagbukas yung valve na yan, what will happen to the blood? The blood will flow. The blood will flow. Okay? Anong tawag doon? Maximum ejection. Again, anong tawag doon? Maximum ejection. Ulit. Pag nag-contract ang ventricle, mag-open ang valve, what will happen to the blood? Flow. Anong tawag doon? Maximum ejection. Paglabas ng blood, what will happen to the valves? Close. To prevent backflow. Nagsarado to. Sarado na to. Konti na lang ang laman ng ventricle, di ba? Lumabas na eh. So anong tawag doon? When all the valves are closed and the pressure in the ventricle is low, kasi konti na lang yung blood, anong tawag doon? Ang tawag doon, Isovolumetric ventricular relaxation. Isovolumetric ventricular relaxation. Ulitin natin. Nag-contract ang ventricle, nagbukas ang blood valves, lumabas ang blood. Paglabas ng blood, anong tawag doon? Maximum ejection. Paglabas ng blood, anong nangyari sa valves? Nagsara yung valves to prevent backflow. And closure of the semilunar valve will produce the second heart sound. The closure of the semilunar valve will produce the second heart sound. Sarado na ang valves, sarado pa tong valves na to. Tama? Okay. Bumababa na ba ang pressure sa ventricle? Yes. Anong tawag doon? Isovolumetric ventricular relaxation. Are we following? Okay, very good. And then we have diastasis. Diastasis is just a matter of time. Diastasis is a time after isovolumetric ventricular contraction, okay, until atrial systole happens. Okay. So, ibig sabihin, it's just a time. This a time after the isovolumetric ventricular contraction before another atrial systole. It is just a matter of time. Okay. Okay. Bumalik na sa atrial systole. Okay. Makinig muna tayo ha. Makinig tayo. Habang nangyayari itong pinag-usapan natin dito, yung pulmonary vein, wala namang valve. Yung superior vena cava, wala ring valve. Yung inferior vena cava, wala ring valve. So habang nangyayari ito punong-puno na ba itong atria na to? Punong-puno na ba yung atria? Punong-puno na ba yung atria? Yes? Okay. So ibig sabihin, bago pa mag-contract ang atria, napuno na yung atria. Tama ba? So pagka nag-contract yung atria, ayan. So may tayo ha, punong-puno na to, punong-puno na. Tama ba? Pag tumaas ang pressure dito, mas mataas kaysa sa ventricle, what will happen to the valves? The valves will open. The valves will open. Anong mangyayari sa blood? Magfo-flow. Tama ba? Magfo-flow. Okay, ang tawag doon ay rapid ventricular filling. Okay, ang tawag doon ay rapid ventricular filling. Teka, dito siya. Supposed to be here. I'm sorry. Sandali lang ha. Yan. The rapid ventricular filling should be here. Sorry. After the isovolumetric, this is the rapid ventricular filling. Kulang po ako. The rapid ventricular filling. The rapid ventricular filling will produce the third heart sound. Okay. So this is a time after the rapid ventricular filling. I-correct natin. I'm sorry. Correction. After the rapid ventricular filling, before another atrial systole. Ayan. Sorry po. And the atrial systole will produce the fourth heart sound. The atrial systole will produce the fourth heart sound. This is S. Ayan. Sorry po. Nagkamali. Corrections. Ulitin natin ha. Okay. Pag mataas na ang pressure dito, mas mataas kaysa sa atria, what will happen? Magbubukas ang valves. So what will happen? Babagsak ang blood. Anong tawag doon pag bumagsak ang blood? Rapid ventricular filling. Okay? Rapid ventricular filling. Okay? So that rapid ventricular filling produces the third heart sound. Then, diastasis is a time, then atrial systole happens again. So, ibig sabihin, bago pa mag-contract ang atria, okay, bago pa mag-contract ang atria, bumaba na yung blood. Bago mag-contract ang ventricle, napuno na siya. Ulitin ko. Bago nag-contract ang atria, napuno na siya ng blood. Bago nag-contract ang ventricle, napuno na siya ng blood. Okay, so this is one cardiac cycle. One cardiac cycle. Again, refers to events taking place in the heart in one heartbeat. Question. Sa isang beat ba ng heart, naglabas ba tayo ng blood? Naglabas ba tayo ng blood in one beat of the heart? Naglabas ba tayo ng blood in one beat of the heart? Yes, okay. During when? During maximum ejection. Again, during when? During maximum ejection. Okay. So what do we call that volume of blood that is released by the heart in one beat? Okay. Ang tawag doon, class, ay stroke volume. Okay. So what is stroke volume? The volume of blood ejected by the heart in one beat. The volume of blood ejected by the heart in one beat. That is about 50 to 100 ml. That is about 50 to 100 ml. Again, the volume of blood ejected by the heart in one beat. The volume of blood ejected by the heart in one beat. Again, the volume of blood ejected by the heart in one beat. Anong tawag doon? Stroke volume. Okay. And there are factors affecting stroke volume. Factors affecting stroke volume. So what are the factors affecting stroke volume? Okay, the factors affecting stroke volume are one, we have the preload. Okay, ano ba yung preload? The preload refers to the volume of blood that is already in the heart before it contracts. The volume of blood that is already in the heart before it contracts. You try to imagine the cardiac cycle. Ang atria ba napupuno na bago pa mag-contract? Yes. Ang ventricle ba napupuno na bago pa mag-contract? Yes. So yung volume na nandyan bago pa mag-contract, ang tawag doon preload. This is also what we refer to as venous return. Venous return. So yung bumabalik sa blood, sa heart, bago pa siya mag-contract. Okay? And what are the factors affecting preload? The factors affecting preload. Okay. Number one is positioning. Okay. Positioning is an independent intervention. Positioning is an independent intervention. And it affects the circulation. Okay, paano? O, makinig ha. Pag tayo tumayo, standing position, siyempre nakatayo ka na ganyan. May gravity, di ba? Is there pulling of blood pababa? Nakatayo, is there pulling of blood pababa? Yes. Nakatayo, may gravity, is there pulling of blood pababa? Yes. Therefore, ay mga anak, nagcha-choppy ba ako kasi internet connection not stable? Nagcha-choppy ba? Choppy ba? Medyo choppy. Okay. I can turn off the video first. Can you hear me loud and clear now? Loud and clear now. Can you hear me loud and clear now? Yes. Okay. Sandali lang. Off ko muna yung video ha. Okay. Off muna natin yung video. Okay. Ulitin natin ha. Pag tayo nakatayo, tayo. There is pulling of blood pababa. Bababa yung pulling of blood pababa. Okay, so what will happen? Less blood will go back to the heart. So kukunti yung babalik sa heart, di ba? There is decreased venous return. Pag decrease ang venous return, decrease ang preload. Pag decrease ang preload, decrease ang stroke volume. Okay? postural hypotension. Anak, relax lang. Pag-uusapan natin yan. Dahan-dahan ha. Dito muna tayo sa normal. Okay? Okay, mamaya natin pag-usapan yon kasi ano tayo, para naiintindihan natin because positioning is an independent intervention. Pag-usapan natin yan mamaya para alam natin. Okay. Pag tayo nakasupine, so what will happen? More blood will go back to the heart. More blood going back to the heart. So pag mas maraming blood ang babalik sa heart, what will happen? Mag-i-increase ang preload. Pag nag-increase ang preload, mag-i-increase ang stroke volume. Okay? Positioning. Positioning is an independent intervention. Number 2, breathing pattern. Breathing pattern. Okay. Pag tayo nag-inhale, inspiration. Okay. Inspiration. What will happen? More blood goes back to the heart. Goes back to the heart. So what will happen to preload? Increase preload. What will happen to stroke volume? Increase stroke volume. So yung deep breathing exercises is good not only for respiration but also for circulation. But when you do Valsalva's maneuver, ayan, ibang usapan to. Valsalva's maneuver, okay, ano ba yung Valsalva's maneuver? This is straining. Pag ikaw ay umiire. So pag umiire, straining, that is expiration with closed glottis. Yan. Pag ikaw ay umiire, there is increased intrathoracic pressure. Increase intrathoracic pressure. So less blood will go back to the heart. There is decreased preload. So pag decrease ang preload, decrease ang stroke volume. So these are the factors affecting stroke volume. Tandaan ha, what is stroke volume? The venous return. It is the volume of blood. So number 1 factor affecting stroke volume is preload. Okay. Nakakasunod? 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 Okay, very good. Okay, let's continue ha. Then we have number 2 factors affecting stroke volume. Number 2, we have letter B to, no? Letter B, we have the afterload. O ano ba yung afterload? Afterload refers to the pressure. The pressure that must be exceeded by the heart before it contracts. The pressure that must be exceeded by the heart before it contracts. Anong pressure yon? That is our blood pressure. Okay, halimbawa, ito ulit yung heart. Ha? Kita natin, ito yung heart. Ayan. Okay. So, anong sabi natin, di ba? Ito yung aorta. Okay, ayan yung aorta. Okay. Meron ba tayong pressure sa aorta? Meron yung blood pressure. Okay? So kapag ang pressure na to, kailangan mas mataas yung pag-contract ng heart kaysa sa blood pressure nito. Itong blood pressure na to, this is the pressure that the heart must exceed, no? Okay, ang tawag dyan sa pressure na yan, afterload. So, pag mataas ang BP, mahihirapan ba ang heart mag-pump? Yes. Pag normal ang BP, hindi mahihirapan yung heart. So, ang tawag natin dyan sa pressure na yan ay afterload. It is the pressure that must be exceeded by the heart before it contracts. Are we following? Are we following? So, what are the factors affecting afterload? Factors affecting afterload. Number 1 is hypertension, increased BP. So pag tumataas ang BP, what will happen to stroke volume? Bababa, diba? Pag tumataas ang BP, bababa ang stroke volume. And the other one is the formation of atherosclerotic aorta. Pag sinabi natin atherosclerotic aorta, ang ibig sabihin nun, there is hardening of the aorta. Tumitigas yung aorta. So pag matigas ang aorta, mahihirapan bang mag-pump ang heart? Yes. So pag tumataas pa lang afterload, bumababa ang stroke volume. Pag tumataas ang afterload, bumababa ang stroke volume. Okay, may block po, meron. At may hardening, yes. Okay, so these are the factors affecting stroke volume. And the last one, we have contractility of the heart. Okay, pag malakas mag-contract, okay, increase contractility. So what will happen? You increase your stroke volume. Okay, pag decrease ang contractility, what will happen? Decrease ang stroke volume. So this is contractility. So the three factors affecting stroke volume are 1, preload, 2, afterload, and 3, the contractility. Again, ano ba yung stroke volume? Stroke volume is the volume per beat. What is the normal volume per beat? 50 to 100 ml. 50 to 100 ml. Volume per beat. Volume per beat. Following? Okay. Nakasunod? Okay, now, can we count the number of beats per minute? Number of beats of the heart per minute. Anong tawag doon? How many number of beats in 1 minute? So, anong tawag natin dito? Sa number of beats per minute. Ang tawag ay, okay, we call it heart rate. Okay, what is the normal heart rate? The normal heart rate is 60 to 100 beats per minute. That's 60 to 100 beats per minute. Okay. Now, do we have factors affecting heart rate? Factors affecting heart rate. So what are the factors affecting heart rate? Number 1, sympathetic nervous system. Sympathetic. Okay. Pag nag-increase ang sympathetic, what will happen to heart rate? Increase. Sympathetic response increases heart rate. Okay. How about parasympathetic? What is the effect on the heart rate? Decrease heart rate. So decrease heart rate. Very good. Decrease heart rate. Okay. Another one, we have thyroid hormones. Okay. Anong nangyayari? Pag nag-i-increase ang thyroid hormone, what happens to heart rate? Pag nag-i-increase ang thyroid hormones, what happens to heart rate? Pag marami kang thyroid hormone, what happens to heart rate? Nag-i-increase din ang heart rate. Pag nagdi-decrease ang thyroid hormone, what will happen to heart rate? Decrease. Okay, very good. Now, how about exercise? Exercise. Okay. Pag nag-i-exercise, what happens to heart rate? Increase. Very good. How about increasing temperature? Increasing temperature. Pag tumataas ang temperature, what happens to heart rate? What happens to heart rate? Increase. Very good. So, these are the factors naman affecting our heart rate. Okay. So, ano ulit ang stroke volume? Ang stroke volume ay volume per beat. Okay. If I combine or multiply that in heart rate, ano nga yung heart rate? We have beats per minute. Okay. So the stroke volume times the heart rate. So what do we get? The stroke volume times the heart rate is your cardiac output. So pag sinabi mong cardiac output, ano yun? The volume of blood ejected by the heart in 1 minute. The volume of blood ejected by the heart in 1 minute. So halimbawa, ang stroke volume natin ay 70. Average, halimbawa, normal yan, ang heart rate natin ay 70. What is your cardiac output, Kim? What is your cardiac output? What is your cardiac output? Okay, the cardiac output is What is your cardiac output? Anak, mga anak, times yan, times, hindi plus, times. Yeah, that's 4,900 ml per minute. Class, ang 4,900 ml ba ay 4.9 liters? Naman, gawin mong liters yan. Ano? 4.9 liters. Eh, pwede ko pang itaas yung stroke volume. Pwede ko pang itaas yung heart rate, di ba? Ay, grabe. Kung itataas ko sa 100 to, itataas ko sa 100 yan. Normal pa rin yan eh. 100 times 100, ilan yan? Hirap ha. Oh, you put that in liters. Grabe, 10,000 ml, 10 liters yan. Ma'am, ang ibig sabihin nun, ma'am, 10 liters per minute ang lumalabas heart. Grabe. Ang sabi sa atin, the average cardiac output according to the critical care nursing is 4 to 8 liters per minute. Imagine mo yan. Imagine mo yan. Tapos yung iba naman, si Brunner, I think that's 5 to 6 liters per minute. Imagine mo yan. Ilan ba ang average blood volume natin? 5 to 6 liters lang po. So ibig sabihin, lahat ng blood mo iikot sa heart mo in 1 minute. Mabilis o mabagal? Mabilis. Napakabilis, ma'am. Correct. Kailangan ba mabilis ang circulation? Yes. Kasi pag bumagal yan, magkakaproblema tayo. Dapat mabilis. Kasi pag bumagal, magkakaproblema tayo. Dapat mabilis. Tandaan mo, the circulation should be fast. Fast, mabilis. Kasi pag bumabagal ang circulation, magkakaproblema tayo dun. Okay? So this is your cardiac output. Cardiac output. So what is cardiac output? Volume of blood ejected by the heart in 1 minute. Okay. So if there are factors affecting the stroke volume and the heart rate, okay, let's talk about the cardiac output. Cardiac output. Sabi sa atin, class, yun daw BP natin, the blood pressure is equal to cardiac output times the total peripheral resistance. Ano to? Total peripheral resistance. The total peripheral resistance. Okay. Yan, okay. The BP is equal to cardiac output times total peripheral resistance. Okay. Kung ang cardiac output natin, class, ay stroke volume times heart rate. Yan. Yan ang ating cardiac output. What will determine the total peripheral resistance? What will determine the total peripheral resistance? Number one, the diameter of the blood vessels. The diameter of the blood vessel. Tandaan mo to ha. Pag nag-vasoconstrict, okay, increase ang TPR. Pag nag-vasodilate, decrease ang TPR. Another one is the viscosity of the blood. Mas malapot ang blood, mas mataas ang resistance. So dalawa ang nagmamatter sa total peripheral resistance. Ano to? The diameter of the blood vessel and the viscosity of blood. Pagka vasoconstrict, tataas. Pag nag-vasodilate, bababa. Okay. So those are the factors. Those are the factors that will actually affect your total peripheral resistance. Okay? Okay, o makinig tayo ha. Ang sabi sa atin, class, pagtataas, ito na lang, pagtataas daw ang cardiac output, okay, tataas ang BP. Pagbababa ang, pagbababa ang cardiac output, bababa ang cardiac output, bababa ang BP. Pagtataas ang total peripheral resistance, tataas ang BP. Pag bababa ang total peripheral resistance, bababa ang BP. Are you following? Are you following? Nakakasunod ka? Yes. Okay. Okay, very good. The equation, lagay natin na, the equation is directly proportional. It is directly proportional. Natin, pagtataas to, tataas to, pagtataas to, tataas to. Pagbababa ito, bababa, pagbababa, bababa. Directly proportional. Sunod ha, nakasunod. Okay. Sige, gawin natin to. Okay. Anong ginawa ng patient? Gagawin ko ha. Tumayo yung patient. Tumayo. Standing position. Ano nangyari? There is decrease stroke volume. Kasi tumayo ka, di ba? So pag tumayo ka, more pulling of blood pababa. So there is less preload. So pag kukonti ang preload, bababa ang stroke volume. Di ba? Okay. Bababa ang stroke volume. Pag bumaba ang stroke volume, bababa ang cardiac output. Bababa ang BP. Okay. Makinig ha. Hindi bababa ang BP. Bakit? Kasi normally, okay, mag-aano tayo? Mag-compensate tayo. Kung ikaw ay normal ka, normal. Pag tatayo ka ba, bababa BP mo? Sige nga. Every time ba natatayo ka, sige nga, mahihilo ka. Ikaw, normal ka eh. Pag tatayo ka ba, mahihilo ka. Sino dito ang pag tumatayo, nahihilo ha? Sige, magpunta ka sa clinic. Okay? Again, dapat bababa ang BP. Pero hindi bumababa ang BP because the body compensate. The body compensate. Sulat natin. Kapag tayo tumatayo, bumababa yung stroke volume, di ba? Bababa yung cardiac output. Dahil normal ka, hindi bababa ang BP mo. Bakit? Kasi the body compensate. Anong gagawin ng body? The body will cause vasoconstriction. Pag nag-constrict ang mga blood vessel, tataas ang resistance. Mababa nga to, mataas naman to. The BP remains normal. Because, anong meron? Compensatory mechanism. Did you get it? Ano yung compensatory mechanism? Vasoconstriction. Naintindihan? Eh ma'am, wala po siyang compensatory mechanism. Aha, pag ikaw walang compensatory mechanism, wala. Ay ano mangyayari? Ayun, pag tatayo ka, bababa ito. Your body is not compensating. What will happen to the BP? Bababa rin. Mahihilo ka. Hindi ka normal. May problema ka. Wala kang compensatory mechanism. Okay. Anong tawag doon? O yun yung sumagot kanina. Ang tawag doon, postural or orthostatic hypotension. Ito ba ay walang compensatory mechanism? Yes. May problema siya eh. May problema siya. Okay, kasi kung normal ka, hindi mangyayari sa'yo yan. Eh normal ka eh. Hindi yan mangyayari. Okay? So this is your compensatory mechanism. So hindi ito mangyayari. Gawin natin tong red ha. Ayan. Kasi hindi ito normal. Ayan, lagay natin siya. Hindi normal yan. Okay? So let's have another one. Ma'am, paano paghihiga naman tayo? Higa. Okay. So if you are in a supine position, so what will happen? Ma'am, mag-i-increase naman ang stroke volume. Ala, sige nga, tignan natin. Pag nag-increase ang stroke volume, mag-i-increase ang heart rate. Sabi mo sa akin, pag humihiga ka ba, naha-high blood ka? O dali. Pag humihiga ka ba, naha-high blood ka? Pag humihiga ka ba, naha-high blood ka? Hindi po. Okay. Hindi. Okay. Bakit? Kasi pag tumataas ang stroke volume, anong ginagawa ng body? The body compensate. Very good. Anong ginagawa ng body? Sorry, hindi eh. I understand the excitement. Pagka tumataas ang stroke volume, hihiga tayo, ang ginagawa ng body, nagdi-decrease ang heart rate. Okay. So pag tumataas to, bababa ito. Anong tawag doon? Compensatory mechanism. Kaya pag nahihiga ka, nag-slow down yung heart rate mo. So pag bababa to, what will happen to the cardiac output? Cardiac output is normal, then the BP is normal. Anong tawag doon? Compensatory mechanisms. Did you get that? Did you get it? Yes, very good. Okay, very good. Okay. Eh ma'am, punta naman tayo, punta naman tayo sa afterload. Okay, sabi natin, ma'am, paano pag tumataas yung BP? Tumataas yung BP eh. So pag tumataas ang BP, nahihirapan po yung heart na mag-pump. Okay, what will happen? Okay ha? Pag tumataas po yung BP, ito ha. Okay, di ba sabi natin yung BP, yung cardiac output, di ba? Okay. So pag mataas tong BP na yan, tumataas ang BP na yan, what will happen to stroke volume? What will happen to stroke volume? Pag tumataas yan, bababa yung stroke volume, bababa yung cardiac output, di ba? Mahihirapan mag-pump yung heart, di ba? Bababa yung cardiac output. Again, this will not happen. Ulitin natin ha. Pagtataas ang BP, what will happen? Decrease ang stroke volume. Pag nag-decrease ang stroke volume, decrease ang cardiac output. Ay, hindi mangyayari yan. Bakit hindi nangyayari yan? Because the body will compensate. Body compensate. Ay, anong compensatory mechanism yan? Okay, compensate. Paano magko-compensate? The heart will enlarge itself. Lalakihan niya yung sarili niya. Anong tawag natin sa heart na malaki? Ang tawag cardiomegaly. So pag lumaki yung heart, mas malakas mag-contract. Pag mas malakas mag-contract, what will happen? Okay, there is increased contractility. Pag nag-increase ang contractility, then the stroke volume is normal. Cardiac output is normal. Anong tawag doon? Compensatory mechanism. The heart has a very good compensatory mechanism to normalize everything. Did you get that? Okay. Ang cardiomegaly is not a disease. This is a compensatory mechanism. Okay. So pag tumataas ba ang BP, do we expect the patient to have big heart and large heart? Yes. Ano yun? It's a compensatory mechanism. This compensatory mechanism is a response to a pathologic condition, kagaya ng hypertension, So do we expect patients with hypertension to have big heart? Yes. But this cardiomegaly is also a response to a physiologic condition. Meron bang mga tao na normal na malaki yung heart nila? Meron. Sino sila? Ito yung mga athletes. Ang mga atleta ba ay into strenuous activity ba yan? Strenuous activity ba sila? Yes, okay. So anong nangyayari? The heart has to compensate kasi kailangan nilang tumakbo, kailangan nilang mag-boxing, mag-wrestling, mag-weightlifting. So expect their heart to be enlarged as well. So malaki yung heart nila. We expect the heart to be big. Is that normal o abnormal? Normal sa mga atleta yan. Itong sina Heidelin Diaz, sila Manny Pacquiao, malalaki yung mga heart nila. Kaya pag tumakbo yung mga yan, parang hindi man sila hinihingal. Kayang-kaya nila yan. Diba? Tayo, malamang mga 1 kilometrong takbo lang, hingal na tayo. So this exercise will really do a lot in our cardiovascular system. It gives us endurance. Did you get it? Okay, so pag tinanong kita, what is the primary organ being affected by hypertension? Ang pinaka-primary organ na maapektuhan ng hypertension ay yung heart. Because it is the heart that will go against high blood pressure, di ba? Imagine mo to, yung heart talaga ang mahihirapan, di ba? Kasi siya yung mataas na BP eh. Eh bakit ngayon, ma'am? Nasira na yung kidney, yung heart okay pa rin eh. Because of hypertension, na-stroke na yung patient eh. But the heart is still functioning well. Eh bakit ganun? Because the heart has a very good compensatory mechanism. It has a very good compensatory mechanism. The heart compensate. Did you get it? Naintindihan ako? Very good. Okay, naintindihan ako. Thank you. So this is our anatomy and physiology of the heart. Tapos isusunod ko na yung mga disorders. Mga anak, i-stop ko muna daw yung recording stop.